My name is Dr. Rachid Assina. I am originally from Morocco, grew up in Morocco, came to the United States when I was 21. I did my first career training in Boston, Massachusetts. I was a pharmacist. I worked as a pharmacist for a few years before I decided to change career and go to medical school. I went to medical school in Ross University. After graduating from medical school, I did neurosurgical residency at Rutgers University. I also did an orthopedic fellowship in Sinai in New York City. And then I started practicing as an assistant professor, teaching residents at Rutgers University for approximately 5 to 6 years, then moved to private practice. And I opened my own practice about a year ago, and we practicing at Montville. My biggest challenge, I think, was learning English, coming from a country that only speak French and Arabic. It was very challenging coming to the US, not speaking a word of English, trying to earn a living and also trying to go to school. So basically, I had to relearn everything that I learned in the past in terms of schooling in order to go to school and attend pharmacy school, then at medical school afterwards. Thinking of where I came from and where I am today, I think my first job in the United States was doing dishes and driving a cab in Boston, being a pizza maker at an Italian restaurant, to being a neurosurgeon. I think it's a blessing. It's a fact that is a testament to who I am and how resilient I am and how patient I am in doing things the right way and to achieve the best outcome. Keeping up with the technology, keeping up with the research that I was a part of Rutgers University, publishing papers and using the latest technology makes my job very easy and also makes the outcomes for my patients much positive. I think being able to integrate the robotic surgery in terms of spine, navigation in terms of cranial and spine as well, and introducing also the artificial disc, lumbar and cervical, my practice and my patients have a much better outcome using these latest technologies. Doing neurosurgery, when I went to medical school, my intention was to become an internal medicine doctor, but when I started my rotations, I thought that the outcomes were not as drastic as I wished they were. So I started thinking about general surgery. Then I basically fell in love with neurosurgery. The reason is that we basically change people's life. People come in as in coma or having a major trauma, and through our surgeries, patients the next day they become awake, they can talk to their family. Also, we have patients that come in car accident with traumatic injury to their spine, not able to move their extremities, and through repairing their spine and taking the pressure of their spinal cord, they can basically walk out of the hospital. And those are the most rewarding things that we do and the most life-changing for patients.